All right, so today we're putting on our detective hats. We're tackling a really baffling medical mystery called encephalopathy. Think of it as a sudden, confusing state where the entire brain just isn't working right. And it's our job to become the detectives who figure out why. Let's get into it.
So get this quote, because it basically hands us our entire game plan, 80% from just listening to the story. This tells us right away that solving this case isn't about some fancy, high-tech machine. Nope. This is about old-fashioned detective work, listening carefully, observing closely, and just putting the clues together, one by one.
Okay, first things first in any investigation, right? You have to understand the crime scene. And here, we're not looking for a single busted light bulb. We are dealing with a massive, system-wide failure, a true brain-wide brownout, where the entire network is just sputtering.
So let's get a bit technical, but just for a second. What is encephalopathy really? Well, you can think of the brain as having two key power systems. One is awareness, that's your cortex, that thinking part. The other is arousal, that's your reticular activating system, which is kind of like the brain's main on switch. When one or both of those systems go on the fritz, the whole system just goes dim.
To make this crystal clear, there's a fantastic analogy. Picture the brain as this incredibly complex, high-tech smart city, all running on a central power grid. Encephalopathy, that's not one building losing its lights. It's a city-wide brownout. The entire metropolis is flickering, and we, the detectives, have to figure out why.
And this really shows you the crucial difference. A focal problem, like a stroke, is that one building going dark. The issue's contained, it's localized. But a global problem, like encephalopathy, means the entire power grid is failing. So our investigation isn't about checking one fuse box. We need to check the main power supply itself.
Every great detective knows this feeling. You arrive on the scene and there's chaos everywhere, but you're looking for that one single thing, that one telltale sign that cuts through the noise and points you in the right direction. And with encephalopathy, there's one crucial first clue.
But hold on. Before we can even find that clue, we have to talk to the witnesses. This is what we call the informant rule. The patient is often way too confused to give us a straight story, so talking to family or friends is absolutely vital. They're the only ones who can tell us the timeline. When did this brownout start? And what does normal even look like for this person?
So you've got the witness statements. You turn to the patient. What do you think it is? What's the one thing the detective is laser focused on? The single most important sign that confirms, yep, we're on the right track here.
And the answer is inattention. That's it. That's the core feature, the clinical hallmark. It's the brain's inability to focus, to track a single thought. It's like trying to tune into a radio station, but all you get is static, drowning out the signal.
Now, you might be wondering, how do you even test for something as abstract as inattention? Well, it's surprisingly simple. You just give the brain a job that requires focus. Ask the patient to say the months of the year backwards. Ask them to spell world backwards. Or subtract 7 from 100 over and over. If they can't stay on task, boom, there's your clue.
Okay, so we've confirmed the nature of the crime, this state of inattention. So now it's time to do what all good detectives do, line up the suspects. And the list of potential causes for this citywide brownout is long, so we have to get organized.
We sort the suspects into 4 main diagnostic boxes or case files. First, is it something toxic or metabolic? Basically, is something from the body poisoning the brain? Second, could it be neurologic, a problem that started in the brain itself? Third, maybe an infection or inflammation. And finally, a modern twist, could it be a complication from a medical treatment? Any seasoned investigator will tell you, you always start with the usual suspects, the most likely offenders. And in the case of encephalopathy, that means we open the toxic metabolic case file before we do anything else. And this chart makes it perfectly clear why. Just look at that huge slice. That's the toxic metabolic category. The vast majority of the time, these are systemic problems, issues happening outside the brain that are causing the brain to fail. So, going back to our analogy, we have to check the power lines coming into the city first. So who are these prime suspects? Well, you've got metabolic failure. Think of this as a fuel shortage, like dangerously low blood sugar. Or maybe a problem with waste disposal, where toxins build up because the kidneys aren't working right. Then you've got medications, which can act like contaminated fuel. And finally, something as simple as a vitamin deficiency, especially thiamine, which is like trying to run that whole power grid without a key component. And that thiamine issue brings us to a must-not-miss diagnosis, Wernicke's encephalopathy. You look for this classic triad. The person is confused, they can't walk straight, and their eye movements are off. And why is this so critical to spot? Because it's reversible. You give them thiamine and they can get better. Missing this is a detective's worst nightmare, an easily solved case that ends badly.
So what happens when the usual suspects all have alibis? The blood tests come back clean. What then? Well, that's when our investigation has to dig deeper. We have to seriously consider that the problem isn't the fuel supply. The problem might be inside the power plant itself. The issue might be starting from within the brain.
And this is where we find some of the more sinister culprits. You could have silent seizures raging through the brain's electrical circuits without any shaking at all. They can only be caught with an EEG. Then there's something like HSV encephalitis, which is basically a brain on fire, a true emergency. And maybe the strangest of all is autoimmune encephalitis, where the body's own immune system goes rogue and attacks the brain. The takeaway is clear. When the easy answers don't pan out, you have to look for these rarer, much more dangerous culprits.
And get this, the list of suspects is always growing. Modern medicine, with all its miracles, has also introduced some new twists. We're now seeing encephalopathy caused by amazing cutting-edge cancer treatments. It's a powerful reminder that for a medical detective, the case files are always being updated.
So, with our list of suspects, from the very common to the very complex, how do we finally crack the case? How do we go from a bunch of possibilities to a single, confirmed diagnosis? Well, it all comes down to having a structured, methodical process.
The diagnostic process works in tiers, and you escalate as you need to. Step 1 is the core stuff: blood tests, a toxicology screen, an MRI to look at the brain's structure, and an EEG to check its wiring. If the answer isn't there, you move to Step 2, expanded testing. This can mean a lumbar puncture to analyze the spinal fluid, or highly specialized blood panels. It's a systematic search, from the broad to the specific.
So after all of that, following the clues, lining up the suspects, running the tests, the case gets solved. But what's the ultimate lesson here? What's the fundamental truth of this whole detective story?
It all comes down to this powerful idea. The technology, the scans, the lab tests, all of it, they're just tools. They're servants. They help, but they don't lead. The master of the investigation is the physician's mind, that incredible human ability to take all the information and weave it into a story that makes sense. The detective solves the case, not the equipment.
And that really leaves us with a final thought. This condition, encephalopathy, shows just how profoundly vulnerable our brains are. How our own personal smart city can have its lights dimmed by a problem happening somewhere else in the body. But that vulnerability is matched by something equally powerful: the elegance of the clinical reasoning used to solve the mystery and ultimately figure out how to turn the lights back on.